In the past year and a half, we've had all these positive phase 3 studies, and presumably all these drugs will be approved sometime in the future. And what we will have to think about in liver cancer is the best way to sequence these agents. Clearly, there's no high-level evidence data to tell us how to sequence patients, but an important concept is, are we able even to sequence patients at all? And I mentioned that in the context that advanced liver cancer occurs in the setting of advanced cirrhosis. And it's important that in order to optimize patients to get exposure to active agents is to identify patients appropriately for systemic treatment. Meaning, in the past, when we didn't have any drugs available, patients would often receive local regional therapies, even beyond where guidelines would recommend. But then even with sorafenib, we know that has still been the case, that patients are not transitioned to systemic treatment at an appropriate time. Really, they need to be transitioned when they have radiographic progression, not clinical progression or decompensation. And that point is even more important now that we have numerous drugs, or will have numerous drugs available to manage the disease, because again, in order to get a patient a second line or third line, we need to get patients to the frontline setting. And if patients are just too ill from their underlying cirrhosis by the time they present to clinicians for treatment, I don't think we'll be able to really see the absolute magnitude of all this research we have done.